Well, today on the show, we're back out at the Pillars here in Biloxi. Of course, the Pillars have been here for a while. Actually became the Pillars a couple of years ago, but they've been known for their long-term, short-term rehab care that they offer. Lisa Fountain is the new marketing director here. How are you?
Good.
Well, good. Welcome to the Pillars.
Thank you. Welcome to the Pillars.
Well, thank you. I've been here several times. I mean, and to see the wonderful work that you do. The Pillars does with, and especially along the line of rehab. And we're going to meet your rehab director here in just a little while, Raquel.
Yes.
But give us a little bit of background, if you would, if someone's just finding out, tuning in about the Pillars.
Okay, well, we are a 180 bed facility.
Mm-hmm.
We have 2 memory care units, one for female and one for male. We have long-term care beds, and we also have
Short-term?
Short-term, yes,
Mm-hmm.
and we call it transitional care.
Okay.
And those are the patients that are coming in for therapy, and we transition them home.
Oh, okay, okay, because I met someone, and I won't name her name, but a dear old friend that is actually here today that's been here for a little while getting some rehab done. And again, short-term, whereas she had a little bit of an accident,
Mm-hmm.
and then she comes here, she stayed here for a while, and then she'll be going home in a couple of weeks.
Yes, absolutely.
So now, you're talking about rehab for people and the short-term, long-term. Is there an age limit kind of thing, or is
No.
it mostly elderly, or like, say someone in their 30s or 40s having to have some surgery or need rehab? Can they come here for that?
Yes, absolutely. If they have the benefit for it, yes, absolutely.
Okay, and I guess their doctor would have to recommend that as well.
Yes, and they also have to usually have a 3-day qualifying stay in a hospital. So.
Okay, so there are some things that they have to go through as far as being able to qualify. Now, what about the long term? Are your beds all full right now? Or?
Almost.
Almost? Okay.
Yeah, no, but for long-term care, usually Medicaid is what pays room and board for the resident to live here. And if they don't have Medicare, they can privately pay.
Okay, and I guess the insurance can, if they have insurance, can that help out as well?
If there's a long-term care benefit, we don't typically see it, but there may be one, yeah.
Okay, okay. And I'm sure you see most of the insurance when it comes to short-term care.
Yes.
Okay. Now, and you have, as we've seen in the past, you've got lunches, the activities that they, the people are involved with. I mean, you really work hard to keep their minds active.
Yes, absolutely. Our activity director, sometimes they'll go out on a fishing trip.
Really?
Yes, and then we have our social services department that pretty much gets them anything that they need if they can't get out and go, so.
Okay. Now, again, one of your big backgrounds here and one of the backbones of the Pillars is the fact that you do have a rehab center here.
Yes.
That covers so many different areas.
Yes.
So we're going to talk to Raquel and find out about the different things that they have to offer here at the Pillars in Biloxi. Raquel Irvin is the rehab director and a licensed physical therapist. How are you?
I'm great. How are you?
I'm wonderful. Now, I've been here several times and always seeing the great work that everybody does with the patients. Of course, we want to show you individual patients and everything. But tell us about, some of the different things that you see, that your people see on a daily basis when folks are going through rehab.
Okay. Well, we work every day with residents who come in with all type of disabilities, surgeries. We offer physical, occupational, and speech therapy services. We also offer outpatient therapy to any residents that are not in the facility. They can come back as outpatients, or from the outside who have doctor's orders can come in as outpatients.
Yeah, and I mean, so if I have, let's say I'm in an accident or something, I need to go through I can get a doctor's order and
come here for therapy. Yes, sir.
Wow. That's amazing. Now, we've seen a lot of different stations here. Some of the different things that you mentioned, occupational therapies. I mean, getting back in the home. I mean, here behind us, we have a mock-up setup of an apartment.
Yes,
with some of the things in there.
Yes, well, we prepare residents to go home, and we actually want them to have a setting to where they can actually do the things that they do at home. We work with transferring residents in and out of the tub and toilet, and onto the toilet, actually performing bed mobility also, cooking, washing their clothes, and feeding themselves. As you can see, we have the apartment here.
Yeah, and I would imagine, Raquel, that comes in handy. Maybe somebody's had a stroke, because I mean their mobility is going to change.
Right.
And you want to be sure that you're not just going to send them off back to the
Correct.
house. And with possibility of an accident happening,
Correct.
that they are able to motivate themselves around
Right.
doing plenty of things.
Strengthening, we work with strengthening, doing contracture management, balance, all that gait, ambulation, even like I said, feeding themselves, any swallowing difficulties they may have, any cognition difficulties they may have. We have therapists who are capable of doing all those things.
Well, I even see a thing over there. They had little bolts and a piece of wood, and the gentleman says, "Oh, you're going to fix the leak for us?" And I said,
Right.
"Okay." Is that? I guess that works with your
Fine motor skills, yes, sir. We work with fine motor skills residents who may have had some type of accident where they are not used to using their fingertips and they've lost that function. We have occupational therapists who do that as well.
But there's different things. Whether it's and I'm sure your therapists are trained, whether it's upper body.
Yes, sir.
Lower body.
Yes, sir.
Mental. You know, as you said, just trying to get those faculties back with them.
Right.
Now, when it comes to outpatient, do you check in with them after they're gone?
Yes, sir.
I mean, let's say I've come here, I've gone through my therapy routine or whatever for the X amount of time.
We
You
do.
gonna check on me?
Yes, sir. We
every
do
now
give a
and then,
couple
make sure I'm
weeks.
still.
3 to 4 weeks, up to 6 weeks, we do call and do a follow-up checkup with the resident or with the patient to make sure that they're still functioning at the same level that they were discharged at.
And whenever you work with them, again with the different stations that you have here, we've shown a few of them. It's kind of they move around to different stations to again work all different parts
Yes,
of
sir.
their mind and body.
Yes, sir. We have, as you can see here, we have a setup where the residents are able to work their arms, able to work on transfers and endurance. We have, right here, we have a diathermy machine where that is for pain management, contracture management. We also have New Step, which works the arm and legs at the same time for range of motion and strengthening.
And for coordination, I'm
Yes,
sure
sir.
a lot of that comes into play.
Yes.
I saw you've got a gentleman that's been here for a very long time. One of his therapy things, and he's a full-time resident here, is painting.
Oh, yes.
He's your resident painter.
Yes, he's an awesome guy. We love him, and we actually love, and sometimes we make that a part of his therapy, doing standing dynamic balance activities while he paints. So it kind of helps him with his gait and transfers all together.
Now, if someone is wanting to find out some more information about the pillars,
Yes.
I guess they can go through their doctors for the rehab part of it, or if you need to, for the long term or anything.
Yes, well, you can contact Pillars, or if you're just interested in Reconnect Therapy outpatient services, we do have a website, reconnecttherapy.com, and you can go there. There is contact information to this facility and our Human Resources Department, and they can get you contacted with us to get you started with therapy.
That's awesome. Thank you very much, Raquel.
Thank
the
you.
Pillars in Biloxi.